Hello, good evening, good day, good afternoon, or good morning, wherever you are in the world. Welcome to the Black Belt Academy of Surgical Skills. My name is David O'Regan. I'm the Director of the Faculty of Surgical Trainers for the Royal College of Surgeons of Edinburgh. I'm a cardiac surgeon in Yorkshire and a visiting professor for Imperial College. First thing to do this week is to apologize to my colleague, Chris Caddy and Sensei of the Sheffield Dojo of the Black Belt Academy of Surgical Skills. As he pointed out, I did not have my belt tied correctly last week, which was rather ironic because we're talking about knots. I hope you appreciate, Chris, I've now got it correct. I want to say a special thank you to my regular followers, Harris and Sienna, and I did promise I'd upload your video for this week. I haven't been able to, and I'm attending to it over the weekend. Sura in Baghdad, and Snezana in Moscow. And there's Demetris at my alma mater, the Royal Brompton in London. There are many more, and I'll name you in future sessions. Tonight, we're talking about forceps. Yep, these are my barbecue forceps, and they are rather crude with teeth at the end. I hold them in my hand for flipping burgers. I don't want to see forceps held like barbecue forceps. Forceps is from the word forca, Latin to grab, and has been used in obstetrics mainly to retrieve babies, alive or dead, in women in difficulty in labor. But it was a French Huguenot, William Chamberlain, who was expelled from France, who came to England, and his sons Peter the Old and Peter the Great. Peter the Old was a doctor, and he attended the wife of Charles I, and he had a set of forceps called the Chamberlain forceps, which he kept in a black box, and they were hidden until the woman was distracted, because they are ghastly looking instruments. But it was Smellie in the 18th century who designed the broad blade forceps as we know today, flattened and curved with the shape of the female pelvis, covered in leather and smeared in pig fat for ease of use. But we are talking about surgical forceps, which is essentially a smaller version of this, but these are solid turners, and again, I'm holding their thumb up and using them to turn solid. The aim of this evening is to highlight to you three important elements of using the forceps. Firstly, the force that you are applying the forceps. Then, the accuracy with which you're picking things up and placing them. And thirdly, the delicacy with which you need to use your forceps. So without much ado, I'd like to take you over to the headcam and explain to you forceps. Well, firstly, I want to ensure that you hold the forceps properly. And using the lumbricals that rise from the flexor retinaculum and the flexor digitorum profundus, and the tendon extends across the finger to the extensor surface in the extensor retinaculum. And what that does is extend the DIP joint. And by extending the DIP joint, you get that movement like Kermit the Frog. Now, in that movement, you are only using predominantly the intrinsic muscles of the hand, including opponent's pollicis. That's wrapping the thumb round and bringing the pulp of the thumb and the finger into contact with the instrument. And that is why holding the instrument with an extended DIP joint cradled in the first interosseous space and literally using them like that. Soft. Now, these are DeBakey forceps, named after a Lebanese-American cardiac surgeon, extremely famous, and has got a single row of fine teeth on this side and a double row of fine teeth on the opposite side. His senior registrar, or senior attendant, was Denton Cooley, and those two fell out. They were good buddies, and they fell out. They went rowing one day, apparently, and they both fell out of the boat. And Denton Cooley could not swim, but DeBakey pulled him back in the boat. And rumor has it that Cooley said to DeBakey, "Please don't tell anyone I can't swim," because he was a good football player. And DeBakey replied, "Please don't tell anybody I can walk on water." But since Cooley took his anaesthetist and moved to the hospital next door across the field, they could see each other through offices. They didn't speak to each other again. Two greats in cardiac surgery who fell out. The other forceps, well, Cooley's forceps, is got a row of 3 one side and 2 the other side that interdigitate. Now, the single tooth forceps is the Adson forceps, named after a famous neurosurgeon, and there's a rat tooth at the end interdigitating with another on that side. Now I'm going to introduce some physics to you, because if applying a lot of pressure, you'll see that my fingernail is blanching, okay? And that's because I'm using my long flexor muscles, flexor digitorum profundus, which is the Popeye muscle in your forearm. And you can see my finger blanching. So when I'm watching trainees operate, I'm watching for that blanching of the finger and correcting the position. So your finger is extended down the forceps and applied, and you won't see any blanching. So there's a little physics here for you. All right. Some say it's not in the back of a cigarette packet, but this is physics on a banana. What we have here is the damage of tooth forceps on this side, grabbing the skin, and what's called crushing or tissue forceps on the other side, but you can see they crush. You see the line from the DeBakey forceps. So if we take pressure equals force over area, newtons over meters squared, I found a paper that suggested that the grip strength in men is bigger than women, and the pinch strength and grip strength increases to the age of probably 40, plateaus out, and starts decreasing after the age of 60. As an aside, grip strength is a surrogate indicator of nutritional status for surgery. So the first thing you should do as a surgeon is shake a patient's hand, and you will actually pick up whether they're wasted or not. Anyway, this paper suggested that the pinch strength between the thumb and finger is up to 87 newtons. And on the banana, I calculated the area at the tip of my DeBakey forceps as 7.5 to 10 to the minus 6 meters squared. And that translates to a pressure of 11.6 times 10 to the 6 Newton meters squared. And for those of you who are interested in the old terms, that equates to 1,682 psi. Well, that's more than half psi that you require to put concrete on your drive safely. Concrete on the drive is 3,000 psi, and your forceps can generate 1,682. So it's not surprising when you actually look at this, the inside is squashed and it's full thickness as well. And there are plenty of studies showing that the mucosa is damaged, and bowel is damaged, and certainly if you instrument the inside of a vessel, then that's the intima, and you can see simply rubbing it, the intima of the vessel is actually damaged as well. So forceps incorrectly used with inappropriate pressure will result in damage to the tissue. So please lighten up. And remember, what you've got in your hand is a lethal weapon that is halfway to cracking concrete. So forceps are ubiquitous on all surgical trays, and you need to be able to use them in the right hand and left hand. If you're beginning and you're asked to hold something, you can put another forcep in to pick it up to steady yourself. But what you should be able to do is independently pick up accurately and deliberately with your forceps, both right hand and left hand. And you can make a game of this, and I will put up Harris's video, which is outstanding, where he did this to a metronome, timed it, encountered it, and did fantastic exercise. The thing about a rice grain is if you grab it hard, there's a tendency for it to slip away. If you grab it too hard, it'll slip away. So it gives you feedback again. Complexity of this exercise can be increased now by using bendy straws. Now, you'll note that the orifice of the straw is actually less than the length of a grain of rice. So not only do you need to pick this up carefully, you need to be able to rotate it around and deliberately put the rice grain in the end of the straws at different angles. Sometimes the angles can be extremely awkward, but this is actually ensuring that you've got accurate control, deliberate pickup. I'm trying to look around the camera as I'm doing this. And you don't need to do this frequently during the week, but if you do it regularly, your dexterity and accuracy will improve. As we've already said, a black belt is a white belt who's put practice in. So although many trainees, certainly in the UK and around the world, might not be getting hands-on experience, that does not mean to say that you cannot keep your hands moving at home on low fidelity models. Again, if you remember that game, it's called, as Simon says, the colors, you can call out the different colors and have a partner call it out and make sure you put it in. You see, I'm having to align the rice with each because the length of it is greater than the diameter. And you should be able to do this, no hesitation, deviation, interruption, or repetition. For those of you who've trained with me, you know that is my mantra in theatre. I'm not asking for fast, I'm just asking for deliberate, and I'm asking for accurate. Almost get it right first time. And this is a fun exercise that you can do at home. So, extending this accuracy, I've been thinking of how to practice at home. I wondered what other things I could use. And I've taken the top off a pepper here. And inside the pepper, you can see there are lots of little pips. And I'm reaching into a cavity. I'm going to pick up these pips from the inside and adding to complexity, dropping them into the end of the rice. Now it's interesting trying to negotiate your forceps into the lumen, so to speak, or into the cavity to pick things up. And don't need rice, simply picking up each of these pips and dropping them in to the end of the rice. And now what we're doing is practicing picking up at depth, because much of what we do in surgery, of course, is at depth. The other thing about these little pips, they're slightly sticky and difficult to pick up. You can't grab them. If you use the word forker, grab, you're missing the point. I would call them a lumbrical instrument. A lumbrical instrument to remind you that you're not to grab with your forceps. So once we have practiced our precision on these models, our next thing to think about is delicacy. Not grabbing, but now forceps are used in tissue planes to delicately lift and separate membranes. And forceps, you've got to remember, should be an extension of your fingers. Yeah? All they do is an extension of your fingers. And actually, many colleagues, when doing cardiac surgery, would insist on holding the vein or radial artery between their fingers because they're well aware of the problem of grabbing. So what I've done here is another model. Just to show you delicacy is I've boiled a tomato. And what we want to do here is delicately peel off the skin of this tomato without tearing it. That's a pretty easy, but it is boiled. If you grab it incorrectly, you can tear it, pull it down. So I'm using two forceps as one. I can use it as a gently brush something off the surface as a blunt dissection instrument rather than poking, and remove. There you go. I can gently brush, use my forceps as well as gently teasing that off with my forceps. And all this is doing is again practicing not only the accuracy but the delicacy that is required. And you can do this with any other fruits as well. So I thought to myself, let's make it even harder, because the important thing is with practice and with models is that you need something that is going to test your skill and push it to the limits. And in pushing it to the limits, you want models that tell you when you're going wrong. So what I've done here, I've taken some tissue paper and I've put it in layers, and I've just put some tea, cold tea on it. And what I want to do is see if I can pick up gently. This is wet tissue paper, very delicate, very soggy, very wet, and gently tease back tissue paper. See if you can pull it off in layers. Okay? And certainly if you're doing burns dressings or changing dressings or skin grafts, your handling of this tissue is not too dissimilar. Let's take it off and then continue with the model. Where's my next layer? I had 5 layers in here. So let's have a look, shall we? See if I can pick it up at edge. But underneath, this is now getting quite soggy because it's been here. You can see just catching it, has torn it there. But picking up the edge, whoopsie, now it's now blotting paper. There you go, there's an edge. And this is how fragile some tissue is. Now, I don't expect anybody to get a whole lot off, but what is this doing is teaching you lightness of touch as you try and lift these layers of wet tissue off. And those of you who have done burns or dressings, I can assure you this is not too dissimilar to burnt skin grafts and ulcerated wounds. this sort of tissue you also find in infected cavities. And infected tissue is wet and soggy and very delicate as well. You need to be able to pull them off in layers without doing any damage. You see, if I grab it or stab at it, it just tears and pulls off. I had 5 layers here. I'm almost down there, but I hope it has demonstrated the principle of how you can practice your simple, delicate skills, forceps at home. So there's one other aspect to your forceps that I'd like to point out. We've done stitching in our previous episodes. The thing is that I've asked you to stitch with your non-dominant hand behind your back. And the reason for that is because I wanted you to concentrate on the rotation and placement of the needle. But of course, we don't operate one-handed, do we? Our forceps are there to retract and hold tissues. And I'd not advocate delivering the needle with your forceps because you'll interrupt that position as we've discussed before. The tissue holds the needle, and in rare circumstances do I hold the needle to stabilize before picking it up. And I usually find that when I'm doing the right coronary anastomosis because there's no tissue on the outside. So the other common mistake I find when people are operating is that as they focus on the operating hand, this not only grabs and pinches, as I've demonstrated the damage, just to remind you, simple physics there, but also drifts and drags. So what I've done here is put staples in the banana, and as I go round, I need to actually hold respective staple in turn without delivering the needle and without pulling or dragging or moving my staple. Because what I often find is as people are focusing, this drags and drifts. So I would like you to practice now combining your needle skills as we've discussed. But now, once you've mastered them and you've got, whoopsie, just dropped out of my needle holder there after a lovely backhand switch, is to ensure that I'm going to hold that one there, pretending I'm holding the tissue and delivering the needle out. And I'll move around and do the same. Next week, we're going to be talking about the assistant. You can imagine the assistant is going to be predominantly holding a forceps. And they will hold opposite. And pretend I'm retracting tissue and delivering the needle and out. And see there, as I focused, I pulled that out and it slipped out. And what you need to practice is going round and round and round without pulling the staple out. And get used to moving your forceps delicately round the model. Remember, that's where I came forehand and backhand. And again, all right. So I'm just focusing as I'm going round. Actually, I like practicing on these models because after a little while, you do find yourself getting into a rhythm. A sort of meditative state as you're going round and concentrating on doing that. Okay? I've covered the maneuvers with the needle previously, so I'm not going to describe them today, but I'm wanting to demonstrate that I'm My forceps is not interfering, is retracting. And that's the whole thing. Your forceps, a bit like a knife and fork, should be complementing the action of one and the other. I do want you to remember that. I do want you to remember those equations and those numbers, because as I worked them out this evening before we went on, I was astounded. But actually, when you look at the result, I am not. And that's why most surgeons, when they close the skin, use a skin hook to reflect, or if you're using tooth forceps, just use the hook, one side, to lift and reflect. Never ever grab. And that applies to every single bit of tissue you're going to be operating on in the body. So I hope that makes sense to you. And I hope you now understand there are a number of principles with holding the forceps. One, hold it correctly. Remember that the pressure at the end is dictated by how you hold it. And as you're focusing on the other hand, you'll be putting a lot of pressure on too. Two, they've got to be accurate. And three, delicate. Because the forceps is incorrectly named as far as I'm concerned. It's not for grabbing, not a forker. I'll call it a lumbrical. Thank you very much indeed for joining the Black Belt Academy of Surgical Skills. I look forward to seeing you again next week, and I'm always delighted to receive pictures and photographs of your practice at home. I'd like to see your challenge on wet tissue paper. And next week, I'm going to introduce assisting again in a new dimension. Thank you very much for supporting the Black Belt Academy. I trust you are safe. We coming out of lockdown in the UK, but I appreciate in many parts of the world, COVID is still a problem, and I'm sure it will be for some time. So please be safe. Do remember, you do not have to be in theatre to practice your skills. Good night, good day, good morning, good afternoon, and thank you again. Bye-bye.